One more area micromanages our lives. I tried to get an appointment with your office. I called and spoke with your staff, and your staff said to me, the member I spoke with said, Paul, have you ever actually tried to book an appointment with the senator? And I said, you know what? I haven't. And he said, would you like to speak with his scheduler? And I said, yes, I would, thank you. He put me through, I got the voicemail, and 3 days later I got a letter signed by your chief of staff that you were too busy to sit down with an ordinary citizen like me when you were on your recess. Well, you know what? I'll tell you what. You were, as far as I was concerned, you were hidden for quite a while. No offense, Sheldon, but you probably ought to go out on your own. Because you've got 2 years. Nothing personal.
I'm very proud of Jack
But you've been there long enough. It's time for you to go. We'll deal with you in 2014. But the real issue is that by what stretch of the imagination, how am I supposed to trust the federal government to not invade more of my life rather than less, when that is the historical track record? What we want is to secure the blessings of liberty. What we want is opportunity. Socialism is the equal distribution of misery, and that's where this is going to invariably take us. That's the bill. That's the bill. Here's my question. Have you read that bill?
Yes, we all read it.
Have you read the health bill?
I read it.
You shook your head yes. You read the stimulus.
Fine, now that's a good question.
You're telling me what you read. For the vote. I don't believe you.
I don't believe you either.
Please be courteous and let them answer.
As far as I'm concerned, I respect your work. I respect the fact that you're serving your nation. But I have no obligation to be polite to an institution and people, not you personally, but the Senate and the United States government that is a mugger.
There is absolutely nothing that you have said tonight that is inappropriate in any way. Everything you have said is perfectly legitimate and appropriate. But let me respond, because I have a slightly more optimistic view about the federal government than you do. You've listed a number of areas that have not been very successful, often simply because Congress itself didn't put the money in when it should have. Medicare is an effective program, it just hasn't been funded. Social Security has kept a generation of seniors out of poverty. It just hasn't been funded.
Intended to be a trust fund. It has gone right into the general treasury.
I agree with you about that. It has not been properly funded. But the federal government also put a man on the moon and a lander on Mars, did the Marshall Plan to put Europe on its feet after World War II, led a great deal of the civil rights activity in the South. I mean, it has not all been a disaster. And there's nobody else that can change the dynamic of the marketplace when there is a market failure. I do not oppose the free market, and I do not oppose the private sector having an active and, in fact, dominant role in the health insurance arena. But if the terms aren't right, then it doesn't make sense. Let me give you 3 examples that I think are very legitimate examples of where there's a problem. Let's say that you're a doctor who wants to put an electronic health record in for your patients. And we all know that a good electronic health record at lower cost can provide better care, can eliminate errors, can catch problems, can do a lot of good things. We also know that the intensive care unit reform that is happening in Rhode Island hospitals is very effective in lowering costs and improving outcomes. It saves lives and it saves money. It's a great thing. And if you go to our health centers, I see some people here from our community health centers, they can invest with people who are their patients who have diabetes to make sure that they stay on their treatment, that they do the testing right, and that they don't end up losing their vision, losing their legs, in very expensive medical cases. But in all those 3 things, if you're the doctor investing in electronic health record, if you were the hospital doing the intensive care unit reform, if you're the community health center trying to help out your patients with diabetes, the market doesn't work for you because you put up every dollar. You take all the risk, you take all the hassle, you take all the nuisance, and you don't get the benefit back. The benefit goes to the federal government, goes to United, goes to Blue Cross, goes to a degree to the patient, but it doesn't come back to you. So that great risk-reward engine that is the driver of American capitalism doesn't work right. And that's why I think, particularly in those areas, it's important to push support into those areas and to start to change the ground rules. If you're a 62-year-old, what? Okay, 60. What private insurer in their right mind would spend money on you for a prevention program when at 65 you're going to go into Medicare and not be their problem any longer? So there are these market failures that I think is our main job to try to correct. In a pure market, I agree with you, but I don't think healthcare is a pure market because of the way it's been carved up into payers and providers, and it just doesn't work right. So that's my thanks to the government.
Frank, thank you. Very appropriate. The whole point here is trying to not sit there and to listen to people. Not everyone agrees with us. Some that disagree with us absolutely. We try to have a dialogue, and I think Michelle was working on that side. But just a question about the private sewage, just in general. If the private market works so well, why do we have all these problems with access to health care? It's interfered with. But we're not in, frankly, the ethnics of the world are out there. They can set their standards, their policy. They can do all these things. They're not, in fact, they are, they have their own ability to operate, except for the solvency requirements of the insurance.
There are over 1,000 healthcare providers. I'm talking insurance companies in the United States. If we were allowed to shop around the country, there would be competition. It's not allowed to happen. So there are free market solutions we won't even try.
But here's what we're...
Instead, we go right to the jugular with
Paul,
coercion from the federal government.
Here's what we're trying to do. We're trying to set up an exchange that is efficient, basically based upon a computer website, where you can go and you can do exactly right. It won't be nationwide initially, it'll be state by state or region, because in Rhode Island, southern Massachusetts, eastern Connecticut makes a service group. That's exactly what we're trying to do.
No, you're not.
Well, that's
So we're trying to do anyway. We're going to take 2 more questions because it's getting to be 7:30, and then we will stay around. And there was a lady back here who had her hand up for a long time, and this gentleman here had his hand up for a long time. And I'll stick around. There are a lot of hands up, please. But not in 2 hours.